Vitamin B12 deficiency symptoms that should never be ignored. Vitamin B12 is an essential nutrient that plays many crucial roles in the body. It helps make DNA and red blood cells, keeps the nervous system functioning properly, and more. Unfortunately, vitamin B12 deficiency is relatively common, especially among older adults and vegetarians. An estimated 6% of people under 60 and 20% over 60 are deficient in this important vitamin. Not getting enough vitamin B12 can cause many symptoms that affect many aspects of health. Here are the top 9 symptoms of vitamin B12 deficiency. 1. Fatigue and low energy. With vitamin B12 deficiency, you may feel exhausted no matter how much rest you get. You wake up feeling just as tired as when you went to bed. Simple tasks like showering, making breakfast, or grocery shopping leave you drained. You may need to take frequent naps and rest breaks throughout the day. Your muscles feel weak and sore easily, even after minimal activity. Exercise performance and endurance suffer dramatically. Lifting groceries or climbing a flight of stairs can leave you winded. You may sleep 10+ hours a night and still feel like you haven't slept at all. The mental exhaustion can be just as debilitating as the physical fatigue. Focusing, thinking clearly, and making decisions becomes extremely hard. 2. Shortness of breath and rapid heartbeat. Even minor physical exertion, like walking across a room or up a few steps, can leave you breathless when deficient in vitamin B12. Your heart races and pounds in your chest after the slightest movement. Your breaths feel shallow no matter how deeply you inhale. Once you stop moving, it takes many minutes for your heartbeat and breathing to return to normal. You dread having to do activities that require moving around. Simple tasks like grocery shopping, laundry, and getting dressed make you short of breath. Your heartbeat feels irregular at random times, even when at rest. You may also experience heart palpitations, feeling your heart suddenly beating harder or faster before returning to normal. 3. Numbness and tingling. With vitamin B12 deficiency, you may lose sensation in your hands and feet. It starts as tingling or pins and needle sensations, then progresses to numbness, making it difficult to feel anything. You may accidentally bite your lip or cheek while eating. Your fingers go numb after holding something like a phone or book. It becomes hard to grip objects, open jars, or fasten buttons and zippers. You easily lose your balance. The numbness makes your hands and feet feel clumsy. Walking becomes challenging as you can't feel the ground under your feet properly. You're prone to stubbing toes or having minor falls. The numbness worsens over weeks and months if untreated. The loss of sensation puts you at high risk of wounds, burns, or serious injury. 4. Problems with balance and walking. Vitamin B12 deficiency can impact your spatial awareness and balance. You feel off balance and dizzy frequently. When you walk, it's as if you're unsure where your body is in space. You drift and sway on turns. You misjudge distances or knock into walls and furniture. Standing or walking in the dark is especially challenging. Going up and down stairs becomes difficult and dangerous. You grip handrails tightly, fearful of falling. You may need to hold onto walls or use furniture for support when walking indoors. Your gait becomes wider and slower in an attempt to stay balanced. Tripping or stumbling happens easily. You fear falling when walking or turning too fast, so your movements are very cautious and deliberate. 5. Vision loss. Without enough vitamin B12, you may experience vision changes and loss. Symptoms start with difficulty seeing at night or in low light. Your eyes don't adjust well from bright to dim settings. Colors start appearing less vivid or distinct. Fine details become harder to see up close. You hold books and phones farther away to read. Halos appear around lights. Your eyes feel tired and strained easily when reading or looking at screens. Over time, your central vision starts to blur. You experience double vision when looking straight ahead. Eventually, you may develop patchy blind spots in your field of vision. Without treatment, the visual changes worsen and can lead to significant vision loss. 6. Behavioral changes. Vitamin B12 deficiency causes brain fog, confusion, and memory loss. You feel mentally slower and have trouble focusing or paying attention for long periods. Learning new information is difficult because nothing seems to stick in your memory. You need to reread emails and texts multiple times to retain the meaning. Names, words, and facts slip your mind frequently, even major events that happened recently. Keeping track of appointments and obligations becomes hard. You misplace items around the house often. Following recipes or instructions is frustrating. You feel your thinking skills have deteriorated, like you have dementia. Personality changes like increased irritability, mood swings, and social withdrawal often accompany the mental fog. 7. Pins and needles sensations. With vitamin B12 deficiency, you may feel painful pins and needles sensations, or a prickling tingling in your hands, feet, arms, or legs. It usually starts on both feet and then travels up the legs. The sensations range from mild tingles to severe painful jabbing. Symptoms get worse at night or when not moving for a while. The limbs feel like they've fallen asleep, yet moving around and massaging them doesn't relieve them. The tingling can be in isolated spots like the toes, heels, or fingertips, or it may affect a whole limb up to the knee or elbow. The painful sensations flare up suddenly and disappear quickly before returning minutes to hours later. 8. Pale skin. Without enough vitamin B12, your complexion loses its vibrancy. Your skin develops a distinct pale, sallow appearance with a yellowish or gray pallor. Veins appear more visible through the skin. Dark circles emerge under the eyes, giving you a worn-out look. Any blemishes and red patches stand out more against the pale skin. Because B12 is needed to produce new red blood cells, their lack causes anemia, which gives skin a noticeably pale and unhealthy look. Your lips, gums, and nail beds also lose their pinkness and turn pale. In severe deficiency, jaundice develops, causing yellowing of the skin and whites of the eyes. 9. Constipation, diarrhea, and gas. Vitamin B12 deficiency commonly causes digestive issues like constipation, diarrhea, nausea, and bloating. You experience abdominal discomfort, feelings of fullness, growling stomach noises, and general GI distress frequently. Bowel movements become less frequent, and stools are small, hard, and difficult to pass. Or you may have loose, frequent stools along with urgent diarrhea. Excessive gas and belching can become an everyday problem. Your appetite plummets even for favorite foods. Over time, you may lose weight unintentionally due to poor nutrient absorption and digestion. The GI symptoms come and go, but don't resolve until the deficiency is corrected. Risk factors for vitamin B12 deficiency. Certain people have an increased risk of vitamin B12 deficiency. Older adults, up to 20% of people over 60 are deficient in B12. Absorption decreases with age. Vegans and vegetarians. This vitamin is naturally found only in animal foods, putting vegetarians at risk. Those with pernicious anemia. This autoimmune disease hampers the body's ability to absorb vitamin B12 from food. People with gastrointestinal disorders. Issues like celiac disease and Crohn's disease may decrease B12 absorption from foods. Those who have had gastrointestinal surgery. Procedures like weight loss surgery often remove parts of the stomach and small intestine that aid in vitamin B12 absorption. People taking heartburn drugs. Medications like proton pump inhibitors hinder B12 absorption by reducing stomach acid production. Preventing and treating vitamin B12 deficiency. If you are at risk of vitamin B12 deficiency, there are some steps you can take to help avoid it. Eat B12 fortified foods. Many grains and cereals contain added vitamin B12. Take supplements. Vitamin B12 supplements can help vegans, vegetarians, and older adults meet their needs. Get injections. Those with absorption issues may need injections to increase their vitamin B12 levels. Treat underlying conditions. Improving conditions like anemia and digestive issues can help increase absorption. In conclusion, identifying and correcting a vitamin B12 deficiency as early as possible is important to prevent permanent nerve damage and other complications. Most people respond well to vitamin B12 supplements or injections and make a full recovery. However, nerve damage that occurred before treatment may continue to progress or remain unchanged. The recommended daily intake of vitamin B12 for adults is 2.4 micrograms. Older adults over 50 should aim for most of this from supplements or fortified foods rather than dietary sources alone. Increasing your intake of vitamin B12-rich foods, taking supplements, and getting proper testing and treatment can help get your levels back to normal before deficiency causes lasting effects. I hope you found this video informative. Please like this video to help others find it. Please share it with family and friends to spread awareness.